Today we are releasing a report that was completed as a result of the external review, which has been completed in the pathology laboratory. This review is initiated with regards to concerns that were being expressed both by laboratory management and by the staff pathologists. First and foremost amongst these concerns were workload, workflow, issues of transparency, and stress. The concerns came to the forefront in December and prompted the then Clinical Chief of Laboratory Medicine to submit his resignation. We decided not to accept the resignation, but rather to have the Institute of Quality Management and Healthcare undertake the review to see what some issues were. Perplexed as to why there remained issues of concern in the pathology lab. Perplexed because a number of new initiatives had already been in place in recent years, and we felt that that should have led to a more stable and better working environment for pathologists and for the leadership team. In 2008, the provincial government announced the following: a significant increase in salaries for the pathologists through an investment of $5.7 million once all positions were filled, making the pathologists here among the best. However, what the review found was that despite the increased salaries and successful recruitment, there were unhealthy working conditions within the lab itself. The key findings indicate the following: a dysfunctional relationship has evolved between the leadership and some members of the group. There is low morale, there is suspicion, and there is distrust within and amongst the group. There are people who are felt to be settling scores, who are being passive-aggressive, hostile, and at times intimidating. The average daily workload has become a daily maximum workload, creating a model of working to a lowest common denominator. There is a perception that there is an inner circle that receives special treatment. While there are technical and clerical support issues, these are not the source of the problem. This may well be the safest period we've ever seen. People are checking and double checking. They are worried about what they're doing and how they're doing it, and certainly we have an external review taking place at the same time through UHN. I think that the veracity of our lab reports are good and will only continue to get better. We have established a relationship with the University Health Network to take on any excess workload that we have as a result of temporary absences of staff, and certainly they have a very quick turnaround time. They are well-qualified, well-known pathologists as well, so that there is no issue with their ability to read. I think that we need to turn our work to rebuilding the relationships between the staff and the pathologists and keeping that level of professionalism and lab test reliability at the high that it's at.